My name is Dr. Laryea. I'm an obstetrician gynaecologist. Miscarriage of a pregnancy, we date pregnancies, we say maybe 28 weeks, 13 weeks, and so on. Now, above the gestational age of viability, when we say that, we mean that above a certain gestational age of the pregnancy, when the baby comes out, with medical assistance, the baby can survive. That is what we say gestational age of viability. But below that, and for Ghana and then the developing countries, the gestational age of viability is from 28 weeks and above. Anything below that means that the baby cannot survive, or it's difficult to let the baby survive even with medical assistance. And then we term that miscarriage or abortion. So any pregnancy which does not reach 28 weeks and then you lose it means that you have miscarried or aborted, So, but early miscarriages, that is abortions, that is up to 3 months. The causes are mainly what we call chromosomal abnormalities. We have certain structures. They are the basis which directs how we develop. We call them chromosomes, and these chromosomes have what we call genes on them. They direct your develop, how you should be, how your heart should develop, and how your bones and things should develop. And sometimes there are problems with them, and then they give the wrong information, or part is cut off, and then a certain part cannot develop, and so forth. So if those chromosomes suffer certain defects which affect major organ development, maybe the heart or the brain or the distinct, the baby dies early and then is aborted. That is why I said when a woman is pregnant and aborts around 3 months, although she can be sad and cry for losing the pregnancy, but at the same time, as I've written in the book, when we have the knowledge that majority of those losses are due to bad development, and if that such a baby crosses and is born, it means it comes out with a major deformity, which puts pressure on the child, him or herself, and the family and the parents. So that's why I wrote that chapter, that although you cry that you have lost, but if you have the knowledge that that baby could have survived with a very major congenital defect, which could have disturbed everybody, then you give it to your God and then move on, because another one will come, and the ones which will come most of the time are normal, So that is miscarriage. We have late miscarriages, which could be due to maybe the mouth of the cervix is weak, it comes out, or something else, fever, malaria, or something could have caused it. But pregnancies which are aborted very early, up to 3 months, mostly are caused by what we call chromosomal abnormalities, which you don't have control over. And we have to be even happy that such a pregnancy has. If even you take a tree which is making fruits, you can see a lot of the fruits is the same. We can compare that as a pregnancy and so on and so forth. Not all the pregnancies, even some are aborted without you realizing that you have missed your period. Very early pregnancies, aborted before, and the period delays 1 or 2 days, then it has come. Maybe it's gone already. So, so those are the challenges. Once the abortive period is over, and then your doctor has made sure that complications of the abortion have been well treated, The next thing, you start your menstruation. And once the woman is feeling fine, there's nothing which prevents her from not trying to get another pregnancy. So after 2 or 3 months, and the pregnancy comes, it will be normal. But some of us try to say that to let the place heal well, so that after 4 months like this, you can try again and see, because there's some literature which says that if the pregnancy comes very early, there's a chance that it may also end in a repeated abortion, But the general advice is that once the woman is feeling well, the menses have started and regularized, she can try. If she gets pregnant, she wouldn't be afraid. We'll take care of it and then move on. Right. This book actually came down to address the challenges in the first delay which results in injury and then death of the mothers and the babies. The book was written to come and address that aspect. So it's a book which is meant particularly for the pregnant women, but because knowledge is acquired over a long period of time, for knowledge to be part of you, it's acquired over a long period of time. Pregnancy is only a very short period of 9 months, and with the challenges during pregnancy, you will read, you will read and try it. But the knowledge in this book also stretches to reach to the general public, so that if either the men or the women, before they become pregnant, have this amount of knowledge already, it helps them plan for the pregnancy, avoid certain things which may affect the outcome of the pregnancy. So it's very good for everybody, every household, to have it, and it's written in a very simple, easy language to understand, And when you face your doctor, you have some amount of knowledge, good knowledge already. You will be able to ask the appropriate questions and get good answers for the questions you ask. So we are not limiting it only to the pregnant women, so that if somebody is giving you an advice which will not be good for the good outcome of pregnancy, either your auntie or your mother or your grandfather, because sometimes they have certain beliefs which are not based on science, and they are telling you, when you have the good knowledge, you know how to navigate without offending, to be able to do the right thing. You can contact Dromo Baby for a copy.